Hello everyone, hope you are doing well. Welcome back to the channel. In this video, I wanted to discuss with you about what to expect in the first 5 days following the birth of your baby from the community aspect of the maternity care in the UK. So once you've had your baby, the first 5 days, community midwives will be involved in your care and your baby's care um, in this period. So once you've gone home, let's say, for example, you've had your baby on a Friday and you go home on a Saturday, your community midwives will be given information about your delivery and how everything went. And then the day after you've gone home, so if you went home on a Saturday, your community midwives will be in touch with you on a Sunday morning to let you know that they would like to come and visit you. They will come home and see you, and they will come to discuss all kinds of information with you. But the most important thing is for us to make sure that you are safe, you are well, your baby is well and healthy, that feeding is going well, whether you are breastfeeding or you are formula feeding or doing both. We will make sure that you are doing everything right. You are sterilizing bottles correctly, you are breastfeeding correctly, and positioning and latching your baby is the right way. We will give you all the support you need. We can answer all the questions you will have. We will also make sure that you are not bleeding too much. Your bleeding is under control. You're not having any clots in your bleeding, and we are not concerned or worried about anything. We will also do things like your blood pressure. We will check sometimes your temperature if we need to, if we're concerned. We will also check your heart rate. We will check that all your vital signs are all well and you are safe. We will also check your baby from head to toe, making sure the baby's got 10 fingers and 10 toes. And we will make sure that everything is well. Baby's skin is well perfused. Baby is looking well, no jaundice, and your baby is meant to be as they should be. So if there is any concerns, we will discuss these with you and we will tell you what you need to do. If at any point we are concerned regards to anything like your blood pressure or the amount of bleeding you are experiencing, we will recommend for you to go into hospital to get reviewed by the doctors. If we are concerned with your baby in terms of whether baby is too yellow or jaundice, then of course we will also advise you to go back into hospital for your baby to get reviewed. So as long as everything is fine and normal as it should be, and you have no concerns or any questions regarding your health or your baby's health, then that will be all that we will do. When we're there with you, we will make sure that we are giving you hands-on breastfeeding, meaning we're going to make sure that the baby is positioned correctly and latching well without you having or experiencing too much discomfort or pain or severe pain, where we are happy, you are happy, and you're comfortable with everything that is happening regarding feeding. If you are choosing to formula feed your baby, we will make sure that you know how to sterilize your baby's bottle. You are also giving the right type of formula milk to your baby, and you're making sure that the baby's milks are timed and you are making the formula correctly. It's very important that you do not make the milk incorrectly, as this may cause some harm to your baby in terms of not making the right amount for baby or the right temperature for baby, and this can cause some issues with baby. So we're going to make sure that everything is right. You may also have some questions regarding yourself with breastfeeding, making sure that everything that you're experiencing or you are seeing is normal. And we will make sure that we reassure you in all areas. We're making sure that you're not, having any swelling ankles or anything that we feel you need any support with or is not normal. We will explain to you. If there is any concerns at all that we feel you need some extra care for, we will definitely make sure that we do advise you on this. We will inform you and we will tell you what you need to do. Now, this is the first day we've come home to you. The day after the next time we need to see you following that will be when your baby is 5 days old. At your 5 days appointment, we will make sure that we will weigh your baby. At this weighing, please be advised, okay, that is very normal and common for your baby to lose weight, some weight from the birth weight. We do expect some weight loss, okay? Up to 10% of baby's birth weight is normal. If it's above this, then we will definitely be exploring why this is happening. We will we will focus more on feeding and making sure that we have some form of feeding plan in place to make sure the baby is feeding appropriately and consistently, with a good understanding from yourself that you are doing everything that you should be doing. Okay, and then we'll make a plan of when we need to come back and weigh the baby again to make sure the baby's weight is not continuously dropping, but instead should be rising and going up. Okay, we will also make sure that baby is of good color again. You know, the baby is not jaundiced, baby is not looking yellow, or the skin is not perfused, and any concerns that we may have. We will also make sure that you are happy in yourself. If you were unlucky and unfortunate enough to be maybe having a tear or an episiotomy or any tears, or you've had your baby via cesarean section, this is the day on day 5 where we will be checking all of these areas to make sure that everything is intact, there is no signs of infection, and everything is healing well. If you've had a cesarean section where you need suture removal, we will be doing this on this day. If you've had staples for your cesarean section, we will be taking half of these out today on day 5, and then the rest of them will be removed on day 7. Okay, so this is what we'll be doing on your day 5 appointment, making sure that you are okay and baby is okay as well. If you wanted us to have a look at the perineum, we will absolutely have a look. If we insisted on letting us check, please try and just let us understand us, and let the midwife check the perineum to make sure that everything is intact. Based on what you might be saying or you might be complaining about, we may want to just have a look to make sure that everything is okay. If you have any concerns such as bladder issues, unfortunately, some women will have the baby and afterwards they may have issues such as incontinence or just not making it exactly to the toilet on time. They may have some accidents. They may also have some issues where they do not feel the sensation of the bladder works. Okay, so you may not feel like you need to go. You may not get to the toilet on time. This is the time that you need to let the midwife know. Because if at any point we may make sure that everything is okay. If it's not, we will advise you on what to do and how to get the help that you need. So please make sure that you are having your bladder works on the back of your mind, that everything is going well. You are feeling the need to pass urine. And when you go, you feel like you have fully emptied your bladder. Of course, there's also the issue of constipation. When you are pregnant, you do experience some constipation. This doesn't resolve straight away after you've had your baby, so it may still continue for a little while longer. So if you are having or experiencing constipation after the baby's birth, around the day 5, please make sure that you are doing all the right things that you need to do, such as drinking plenty of water, making sure that your fiber intake is quite good. You can have things like dates, you can have things like, apple juice on an empty stomach, orange juice on an empty stomach, or strong coffee on an empty stomach. And this really sometimes does help. You can also have juices like prune juice. This will help. But please discuss this with your midwife when they come home to see you, and they'll be able to give you more advice based on your individual issues. Okay? I hope that you find this video interesting and you find it useful. Please do leave me any comments below if you have any comments at all when you've watched this video, and I'll be more than happy to answer them for you. I hope you are doing well. If you're watching me and you've already had your baby, congratulations. And if you haven't had your baby, then at least you have something to look forward to and just some heads up about what to expect in the first 5 days following the birth of your baby in the United Kingdom. This might be slightly different in the different areas and locations that you are in the UK, but it shouldn't be significantly different, okay, as we are all under the same NHS trust and we sort of use the same national guidelines. The trust guidelines might be slightly different, but all in all, it's not so much different. So if you have any questions, please leave them in the box below and I'll be more than happy to answer them for you. Hope I see you in the next video. The next live I'll be doing will be on Friday coming up, and I'll see you around about 8 o'clock UK time. Hope you have a lovely evening, and good luck with your upcoming labor if you haven't had your baby. Take care, guys. Bye-bye.